Welcome to the Trauma Informed Lens podcast. Each week, Matt, Kurt, Jerry, and the occasional special guest explore how the trauma-informed paradigm challenges traditional beliefs and approaches concerning a wide variety of areas. This podcast addresses psychological trauma in an educational manner and is not designed to replace mental health treatment. If anything in this podcast makes you feel uncomfortable or anxious, please talk to a mental health professional.
Welcome, friends, to the Trauma Informed Lens podcast. Today, we've got an exciting special guest. My good friend, Dr. Barbara DiPietro, joins us. And this is also sort of a special collaborative podcast as well. Through my blog and my partnership with the National Healthcare for the Homeless Council, we're really spending their focus and also my focus on that through the podcast and the blog. Is both a recognition of something that's happening on December 21st, which is the annual Homelessness Memorial Day. And also with that, we're also looking specifically at self-care and advocacy as well. I think a lot of us feel like things that highly impact our the clients, the students we work with, their families, such as funding, just in the news, all the sexual assault and violence, child abuse, all these things at the national and also I know happening at the local level really trickles down and can really impact us as well. And so we're going to take a real fun dive into looking a little bit deeper into advocacy, social justice, again with that trauma-informed lens. And one of the topics that I've really focused a lot of attention on in my trainings and my thinking, which is the unfortunate phenomena of homelessness around the country. And just seeing, I know I'm going back out to LA. I've walked around Skid Row, seeing things from New York, even in places like you don't really think about homelessness, all that, talking to people in Pennsylvania, and how the opiate epidemic is really impacting, and homelessness is also an increasing issue around that. And so seeing this around the country, and as I like to say with homeless providers, it's really hard to find somebody that's in a homeless shelter that didn't have extreme trauma, both in their childhood, but also becoming homeless, that experience can be traumatizing in so many ways. For folks as well. So we'll throw our trauma-informed lens on that, and I hope a really meaningful way. And I'm really just excited to partner with the National Healthcare for the Homeless Council, who does tremendous work. And one of the great things of my career is I think I've been partnering with them now. I think my first conference was like 7 years ago. So, and Barbara and I, even though I see her as a professional mentor and has really helped me find my advocacy voice and really helped me connect my social justice work with my work with the trauma-informed lens paradigm. I also just have to, for full disclosure, one of my best friends as well. I was just kind of adding up what we've done together. We've skied in Colorado together. We've shared a good beer in Portland together. We had a night of drinking pickle juice with tequila, I think, in Houston. She's put me up in Baltimore. Her and her husband, John, have stayed with Sarah and I here in Denver. So while she's a professional, a role model for me and has helped me learn so much, also just a really great friend to me as well. So Barbara, I want to turn it over to you just to help us understand. I know you can give a better introduction of the council than I ever could, and a lot about your work with advocacy as, again, that senior director of policy for the National Council. So welcome, and I'm excited to introduce all of our listeners to you and your work.
Thanks, Matt. I'm so delighted to be here. I'm so honored and humbled by your gracious invitation and for your introduction. I also would just like to say my appreciation to you as well, because you've opened my eyes to a lot of ways that trauma is so much more pervasive in our work and on the psyche of the provider service that we provide, but then also just on the experience that our clients are having. And so I just love linking our worlds. I've loved just knowing you and the work that we're doing, and particularly doing the work from the homeless perspective. I've also seen just the wider world of trauma-informed care that you're experiencing with HIV providers and a whole wealth of folks. So I know we've got a lot of people listening to this that are doing a wide range of services, and I just really want to say how much I appreciate all of the work that people are doing and how much more I have learned about what you do and the challenges that you're facing because of Matt and his expertise. So thank you again for having me here. A little bit, you asked about the council and our advocacy work. The National Healthcare for the Homeless Council, we are an advocacy organization, but we also, most of the work that we do is training and technical assistance and research for how we can be providing the best practices in homeless healthcare in this country. And the fact that we have to have evidence-based practices around homeless health says a lot about where we are in the state of affairs. I think it's a national embarrassment that we are establishing best practices and how to deliver healthcare to people who live on the street. But that is what my organization does. We work with a wide network of healthcare for the homeless projects in the country. There are about 300 healthcare for the homeless programs. Largely, these are federally qualified health centers. They deliver very comprehensive outpatient primary care, addiction services, mental health services, in addition to support services like case management and outreach and health education, preventive care. Many of the partners that we work with are medical respite providers, supportive housing service providers. So a wide range of folks that are delivering health care and support services to people experiencing homelessness. Last year, we served about 1 million people. Again, I think that's a national shame that we should have. Yep. If you're paying attention to the news, just this week, the U.S. Department of Housing and Urban Development released its newest report on homelessness, showing that over 500,000 people experiencing homelessness on any given day in this country. And we are the wealthiest country in the history of the world, and we have the resources to do what's right for our citizens, and we choose not to. And I think that's our national shame. So the work of the council is not only to unify the work of practitioners who are delivering care, but also with the vision and the goal of ending homelessness, preventing and ending homelessness through our advocacy work. And so we're using our advocacy dollars, which I would like to do a disclaimer is funded solely through private dollars. We are working with many of our government systems because the public policies that we have are conscious decisions that we make as communities, both at the federal level and at the local level, on continuing the scourge of homelessness. And this is the kind of thing that it is preventable, and we know the solution to homelessness is housing. And we spend far more on other things in this country than we do on providing basic human needs for people living at the lowest poverty ends. So again, just really excited to talk today about how homelessness, but we're in an environment right now that it feels overwhelming. And everyone I talk to, in fact, I don't know anyone who's not overwhelmed working in the advocacy space or working in a service provider space. And so I think having this discussion about how are we taking care of ourselves so that we can be in this for the long haul, because this is not going to be a short-term go-around. Healthcare for the homeless, we established ourselves 30 years ago with the idea that we would put ourselves out of business. And there were people who thought in the mid-'80s, when homelessness was coming up as a result of deinstitutionalization, which a lot of your listeners will be familiar with, people not being able to find services in the community, and a disinvestment in housing. We thought this would be a short-term thing and we would no longer be doing this. And here we are. And this has got to stop. So I'm excited about having this conversation. I'll turn it back over to you, Matt, to take us where you'd like to go here.
Absolutely. Kurt, I'd love to get your thoughts as we kind of utilize this as our bright, shiny object for the week. And I just want to put out there, you may notice that Jerry's not with us today. He had a family emergency. So I know all of our thoughts, prayers, and love go out to him and his family. And hopefully we'll get him back on at the next episode. homelessness, as well as a whole lot of other issues, when we start to put the trauma-informed lens on it, it's an interesting phenomena in some ways because, and Kurt, this is where I love to sort of get some of your thoughts as well. Is on one hand, Barbara's absolutely right. I've seen all this research presented, and you can see correlations between cuts in housing funding and rates of homelessness. I mean, there's like really concrete data to show this. And then the deinstitutionalization of the mental health, systems as we were supposed to shut down. Some of these were pretty bad hospital, state-run hospitals that got all these bad names. I mean, like anything, there were probably some good ones and some ones that needed shut down. We just forgot to build the community-based programs that were supposed to house these people afterwards. And yet when you see assessments like ACE assessments for folks struggling with homelessness, all of a sudden what you see at the same time is high incidences of childhood trauma as well. So Kurt, I just kind of wanted to get, as somebody who may not be thinking about this as much as Barbara and I do, just kind of some of your thoughts on, just homelessness in general and some of maybe your experiences as well.
One of the areas I think of real overlap between the world that you guys are kind of talking about and part of my professional experience has been working with adults with developmental disabilities and intellectual disabilities, which is where there's a lot of homelessness within and across those two populations. And certainly one of the areas I think it was quite important, Barbara, one of the things you said is people feeling overwhelmed, both the populations who are difficult to serve and the people who are trying to serve very difficult to serve populations. There's a lot of feeling of being overwhelmed across those two. And my experience with people who are experiencing homelessness has been on a wide range of some individuals feel perfectly comfortable being homeless and they're okay with it. They've organized their world that way and are pretty comfortable. And then others who are completely uncomfortable in it. Not that either one should stay there, right? That I think your point about we have the resources to help a lot more people than we think that we do is a really good one. So both of those I think are quite important. And I think probably this feeling of being overwhelmed is probably the feeling of being stuck on both sides.
Yeah.
The providers feel stuck because we feel trapped and we can't seem to solve the problem or have enough resources to solve the problem. And the people who are experiencing homelessness feel stuck too. And we all just kind of get stuck there and enjoy our stuckness together in some way. More and more you think about the ideas of a trauma-informed approach, which is that you put so much effort into understanding the environmental factors that are related to the way that problems get created and the way they get maintained, which is certainly a clear driver of homelessness in our country and in many countries. So those are some of my initial thoughts, and certainly one of the things I'm most curious about your experience, Barbara, is the advocacy can be such a tricky game. In that you want to push and kind of push the envelope and change people's thinking. If you push too hard, you don't get invited back. So that I wonder kind of your experience with how do you balance those two things in your position?
So this is actually some of the work that Matt and I have done together is particularly for this community who is so well versed in motivational interviewing. How do you get your clients to come back? And you use the same skills in advocacy conversations, asking open questions, trying to establish common interests, eliciting people's honest thoughts or observations, or how do you work in a clinical space in eliciting goal setting with clients? It's not wholly dissimilar in an ironic way with our elected officials sometimes. Matt and I joke sometimes that you might even encounter some of the same diagnoses, but that's a joke, of course. But at the same time, it is very tricky. And I think there's a couple of challenges with that. One is I hear providers talk a lot about how I'm not an expert in that. And so I'm uncomfortable talking maybe outside my field. And what I would say, a couple of things. One is, first of all, you absolutely are experts in what you're seeing every day and the causes of homelessness and the causes of trauma. And you see with such clarity what could make lives better, both big and large things, big things and small things. And so talking about what you're seeing bridges that gap with what politicians and our policymakers, and they're not all elected officials, right? A lot of our policymakers are not elected. They're in administration, they're appointed, or they're, in a lot of our bureaucrats are actually making a lot of programmatic decisions that have a very wide range of impact. And so how we engage in those spaces and just talking through, what are you seeing? What would work well? What would not work well? We don't have enough of those conversations. We desperately need people who are on the ground and having that experience be a part of that larger conversation, because largely we don't know what goes on. And one of the things that I have found too is that people go into public service wanting to make things better. And even with politicians that you may wholly disagree with on just about everything, they are there because they honestly believe that they are making things better. How do you engage with someone when you both want to make something better? There's a lot of space to have a conversation that is constructive and civil. I would argue this community has the skills specifically to do that, much more so than just about anybody else that I know.
Yeah.
And so that, I think, would be my encouragement, is that we know how to talk with people about in difficult spaces where there may be a lot of disagreement. So I think bolstering confidence in entering into those conversations, and whether that's with your mayor or whether it's with or practicing on your Uncle Al over the Christmas dinner table, I think those are good spaces to talk to. So an example might even be, let's use our president, for example. What do you, with someone that you disagree with, what do you like most about what's happening? Like asking those open questions and then having people articulate themselves gives you a sense of where you can take the conversation. So that would be definitely is jump in, because you already are the experts.
Yeah. I was having a drink with a good friend of mine last night, and we were kind of talking about our perceptions of warmth in other people and what drives that, and how do we generate that, and it all came down to asking questions.
Yeah.
And we were kind of joking about it, thinking, the people who ask the most questions will say that they are the smartest person we've ever met, and we may not even know what they think just because they asked us a lot of questions, right? Really interesting that we forget, I think, so many times too. Yeah. And we've talked about this actually a lot on our podcast, and it's one of the things that I like to give leaders a call to action to a lot, which is to stay open and curious when you're in a position of power. Yeah. And to use your power to get all the voices heard, rather than using your power to get your voice heard the most. Yeah. And that can be easily forgotten in many, many environments. So I love it. I love thinking about how much you can get done by asking good questions. And my training actually in the military was to be trained as an interrogator. So I learned a lot about asking and asking the right question. And we were very systematic in how we were trained to ask questions over and over again. And I really had a lot of fun doing that, learning that approach, and have used it as a clinician. Ask questions and ask lots of them.
There's my shiny object for next week. Is how you transition interrogation skills into your clinical work. So
most of the time when I tell people that story, they go, "Oh, that makes a lot of sense."
And I would also even add that you would be surprised at how many questions our policymakers have of us, if given the opportunity to ask us, because they want to know more about what's happening, and they want to know how they can be part of a solution. And that's, I think, where there's a really nice opportunity to link these worlds together.
Absolutely. And I want to go a little, as we talk about some of the challenges to our self-care, I've thought, and again, just with my own experiences, you know, and to be honest, in my travels, you know, I go to Medicaid expansion states, non-expansion states, and there's all these different realities in our country over the last few years. But for the most part, on these social issues that like homelessness, like you know, educational reform, criminal. I mean, we've sort of been making progress, and now all that, in many ways, due to funding cuts and just philosophical differences, is funded. Kurt, I know we've talked at least around this topic of that them and us sort of mentality. And I think from a self-care perspective, when I look at my own advocacy work a lot of times, even to have some of these conversations with folks, like the senator that I email or call on a regular basis nowadays in my own advocacy work, you know, that there's the emotional side of us can be so triggered right now. And I think one of the things with advocacy that we ask ourselves to do is to really, as far as being the advocate or being the social justice change agent, we challenge ourselves to be the emotionally regulated person in the room. And that's where we have to start from. There's this analogy, I think it was Dr. Haidt used this. I learned it from a Heath Brothers book called Switch, which I thought was really good, about an elephant and a rider when they talk about the emotional and intellectual side of our brain, where the elephant is the emotional side of our brain. And the elephant, it looks like the rider of the elephant is in control, which is the cognitive part of our brain. But when the elephant gets spooked, and nothing kind of spooks our emotional brain more necessarily than having people we care about, and in this case, a lot of our clients, hurt by what policymakers might be doing, and be that them and us sort of mentality. So if the elephant gets spooked, forget about your prefrontal cortex intellectual side. The elephant's going to go wherever the hell the elephant wants to go. And so from a self-care perspective, when we think about our advocacy work, when we even just think about being human beings in today's political environment, we have to do so much emotional regulation just so we don't go in and start yelling at somebody. And I think that is, when we talk about self-care and advocacy and just really self-care in general in today's world, if you watch the news on a regular basis, it's how do we take care of ourselves emotionally? So in some ways, we can be the adult in the room to start out with, because if we go in triggered, we should expect that trigger to come back to us, and now we're butting heads and our elephants are charging at each other. And so, you know, Barbara, when you know, and I know you look at advocacy at a national level, but also I know you're a resource for a lot of people in individual states and municipalities as well. So how do you see the current atmosphere sort of impacting the folks you work with, and maybe even some personal struggles as well, as I know someone with a lot of passion for this?
Yes, it is. It's been a trying time, to say the least. I think part of it is because it felt so much like we were starting to move in a better direction.
Yeah.
And it wasn't like we had gotten the solutions figured out, and it certainly wasn't that we had fixed things, but we were starting to, from a harm reduction policy perspective, we were starting to like do better things. And Medicaid expansion in a lot of places, but not all, was one. Really making better inroads to integrate housing and healthcare, and starting to do that at a broader scale. That was really, you know, moving forward. Like, we were getting better. At the same time, we haven't been doing any, and like when we look at minimum wages, when we look at our labor forces, when we look at our education system, you know, all of those things still have such structural deficiencies. And then you layer on top of it the past year, where it feels like everything that, you know, it's all just being pulled back. So you take these 2 steps forward and you take 3 steps back. And like you said, it feels exhausting because you feel like you're at this constant struggle for just even the most modest gains. And it can be very tempting. And I think what I hear a lot of people say is, it's just so overwhelming, I've just tuned out. And because and I understand that, you know, there's a din to the conversation now that is deafening. I think cable news is a trauma-inducing event every night, and it doesn't matter what network you're on. And so it's this idea of we have so many issues on the table. We talked about, I talked about health and housing and minimum wages, but climate change and the immigration, civil and human rights, the taxes and the economy, and our international situation. I mean, I could go on the list of things that many of our listeners care desperately about. We see the implications for our patients and ourselves and in the broader community that we want. And we know that we don't see our values in action. And I think where we need to be is finding solace in each other, because I think there are communities of people that are coming together. So at the same time that you have people who are tuning out because it is overwhelming, you've got a lot of people who are showing up to demonstrations and marches and writing to their Congress representatives for the first time and really starting to get awakened to the power of stepping up and stepping out and being heard and saying, this is unacceptable. And how that in and of itself is an empowering opportunity for us as individuals, but coming together with our peers in that space can also be so healing for all of us, and start again to move this in the direction that we know we need to go.
Mm-hmm. I wonder, Barbara, if you could give me your thoughts about this kind of idea. And as usual, you didn't even ask me a question. I'm going to give you an answer to a question you didn't ask, but I'm kind of notorious for giving a long answer to even a short question. So one of the things that I'll tell kind of a little story about how understanding, I think, can help so much, understanding processes. So I've watched many families come into individualized education plan meetings, and some of them have an advocate with them. The best advocates I've seen don't come in as a bulldog in this conversation. They come in from a perspective of helping the family to understand the process. And the ones that are least effective don't tell their family anything about the IEP process. They just come in and fight. And they almost never get what they want. If you understand the process, they end up getting what they want. The parent is calm. It just goes so much better. So I wonder, I mean, somebody like you is like hugely rich information to somebody like me, because you live in a different level of change making, and understanding that process of how that happens would be hugely, I would love to hear how that works. And I'm sure like a lot of our listeners would like to understand that as well. Like, how do you think about a grassroots movement, or how do you think about making change in a way that comes from the bottom up, and being able to voice your opinion and do it in a way that gets it heard? And I love what you said about motivational interviewing, and I thought that was really cool. But I mean, if you could educate me a little bit about that, I would love it. I'd just love to hear what your thoughts are.
Sure. I think this is an opportunity for so many of us to learn or relearn, because for many of us, our 12th grade government class might have been a long time ago. How does government work? And what problems get solved in what places? And like you said, figuring out the process. Where do I go to even talk to the right people? And so figuring that out, it can be confusing, right? So it's your local level. Your local mayor controls a lot of things, or your local city or county council controls a lot of like local decisions. So, for example, in the issues of homelessness, how are encampments addressed? Are they tolerated? Are they not tolerated? Are they swept through? How do your police interact with your clients? What kind of training do they get? What kind of accountability is there in your local system? How are housing project criteria established? Often that's at the state level. So are you working with your governor there, or your state legislature, maybe on what your criminal justice system looks like? How your resources at the state level are used, whether your state has expanded Medicaid. That is a wholly state decision established largely either by the legislature or the governor. So like those are just some examples, but to your point, I like to remember that Schoolhouse Rock video about how a bill becomes a law. If we remember that that video, I hope I'm not dating myself too much on that. But this idea of how do solutions get worked through, and where do you go? A lot of times when you join local organizations, you will have people who are giving you scripts. And this is a way of being able to be efficient. Talking points. Here's where you call. Here's what you say. Here's the issue that this body is addressing right now. So that might be in Congress for one issue. It might be in your local city council for another issue. So getting on the right email lists, a lot of directing you to the right places and the right phone numbers and the right emails can roll right into your inbox by signing on to some groups that you really find reflect the values and the solutions you'd like to see.
And one of the things that I've really, as I talk to groups of people around the country, some of them directly providing homeless services or medical healthcare for the homeless services, but a lot of them not in that arena. We somewhat, and this I try not to get frustrated about. I think it's an opportunity more than anything else. There's a lot of us. There's a lot of teachers. There's a lot of social workers. There's a lot of therapists. There's a lot of people that just care in communities like faith communities and other, organizations around here. And, I challenge people at the end of my training about, think about the lowest level that you can advocate. A lot of times we think, well, how do we stop the president? Well, me laying in the street and stopping traffic may get me on the news eventually if I don't get arrested first, but it's probably not going to change what's happening at HUD right now. I would love it if it did. I'd go lay out in the street right now. No offense to either of you two. And it is cold today in Denver, so it would be a sacrifice. But I challenge. Well, what if just sometimes a group of 50 people. What if 50 people reached out to their local school board representative and talked about trauma-informed schools? You're going to get coffee at that level. What if 50 people reached out to their state senator representative at their state house? You might get coffee, but you're at least going to make the radar of folks. And so that's where I really see advocacy as sort of a self-care strategy as well. When we look at this and we look at all the frustrations and all the risk for burnout and trauma that we have in our own jobs, that itself can be overwhelming. But I really worry, and I'd love to get your guys' thoughts about this, because I know, Barbara, you work in one of the great healthcare for the homeless clinics in the country there in Baltimore as well, as sort of your home base. It's like, how does advocacy help us keep healthy as well? And bringing that into our self-care strategy as maybe also we're directly addressing the problem that comes out from all these policies, from trauma. But I just kind of want to get both your opinions on, if we can be a little bit of a part of a solution, how can that help us with our own self-care as well? And any thoughts you guys have on that?
I would start by saying that I think part of what is frustrating in the work that we do normally, even outside advocacy, is when we don't see any progress that we're making. It's always frustrating for us when we're working, and we know what's possible, and we can't seem to get there.
Yeah.
You advocate at a local level. It is so much more tangible in terms of what the problem is and what the solution is. And the people who are in charge of being a part of that solution are also more accessible to you. So it is far easier for you to meet with your local city, or county delegates, or your mayor, or even your housing commissioner or your health commissioner. People in those roles, those are very accessible. And it's much easier to be able to identify tangible pieces to actually fix, where you can see the benefits of your work. I think that's a very self-care piece, is focusing on things that are achievable. I think it is much more frustrating. We're focused on these big national problems, and how do we as individuals feel at all effective, even when we're doing all the things we're supposed to do. We're calling our senators, we're writing our letters, we're doing all of that, but it doesn't feel tangible and it doesn't feel like we're getting anywhere. But you really can do something very specific and targeted together with a motivated group of people. And to your point, Matt, if you can get 50 people together at a local level on any issue, that's going to get attention in a way that it wouldn't nationally. So again, I think it is true. All politics are local, in that's where we start. And that's where I would see the opportunity for self-care through advocacy, is identifying tangible goals locally that you really can see the benefit of your work.
Mm-hmm, mm-hmm. I think too, certainly these ideas of how to understand the process has been a really powerful experience I've seen happen at many, many levels, starting with how do I understand this child or this person who's in front of me and this behavior that they're giving me that I don't understand. And when you apply a lens to understand it, that reduces your stress about it. You're like, oh, I get it. Now I feel like I might be able to predict something, which is hugely calming for a human being to feel like they can predict something. It's a great experience. And then going up a level from there to understanding a group of people and how a group of people could respond in a certain way, and then an organization, and then multiple organizations, and then a system. So these ideas of applying a lens to something, which is something I just love about trauma-informed care, is it's so applicable across so many human endeavors, to understand how people act, how people feel, how people think, and you can understand the process, which I think plays into what you're saying, Barbara, is that you know when to do something that is small enough that it's accomplishable. And when you get to accomplish it, boy, we get a big dopamine rush from that. Like that's a great experience. Whether you're a child learning how to tie your shoes, or whether you're a policymaker getting a politician to change something or to introduce a bill, that dopamine rush is the same. It is a part of our being and a part of our biology that is hugely important, and I think a very big part of self-care. Something I've found incredibly powerful at an organizational level is that education and learning within an organization about what it is that we're doing as our mission is one of the best levels of self-care that I've been able to accomplish. To be able to teach people, how do you understand what you're seeing here today? Like, how do you understand what it is that you're experiencing with this person? It's been more powerful from my experience to accomplish that than to say to somebody, go take a day off and take care of yourself. It's been even more powerful to help them to understand what it is that they're seeing and help them to be effective in what they're doing as a way of being a good leader and who can take care of my people, and a way for them to take care of themselves is through learning.
Absolutely. And I think, again, that reaching out, because I see homelessness is a symptom of so many other things in some ways. It's the inability, again, if we had trauma-informed schools where we could address mental health issues earlier, we may not have the rates of addiction in this thing. If we had more treatment for families, especially, just going to, sometimes I feel Kurt may feel this, we live sometimes in a bubble here in Denver because we're a landlocked island to some extent. Try to find the next biggest city from Denver or the Front Range area at least. And, the joke, you got to drive like 10 hours to find another football game where, I know in Baltimore, you've got like you're in that beltway. Looking at what's happening in rural Pennsylvania where they're having, dozens of overdoses every day. I was talking just to my driver who took me back and forth to the airport. And he's like, you can't find somebody in Pittsburgh that doesn't know somebody who hasn't died of an overdose. And, so to look at, I think so often, and I think this really impacts our self-care and overall health too, we sort of get in our silos where I'm focused on education. Well, I'm focused on developmental disabilities. I'm focused on HIV. And I think we're looking for, at least I am, for leaders in each community that kind of can go above that a little bit and say, okay, if we're really going to end homelessness, which is going to happen in my lifetime, I know it is, we're going to have to get the schools on board. We're going to have to get child welfare, juvenile justice, all these people. And that takes some work. But, you know, while that may seem overwhelming for any individual, what's that first connection that you can make and bring somebody else to the table? So, you know, again, that advocacy is self-care. I want to sort of, as we start to look at this, and just so you know, I'll send you a link. I put a lot of self-care strategies into the blog post that we're publishing collaboratively with the National Council. But I want to, besides advocacy, as two people I know that are really in touch with, you know, policy, what's happening at state, local, and national levels, how are some ways that you've kept yourself healthy, engaged, and motivated in a time where those things might not be easy? Because on one hand, I know we probably all feel we have to watch the news because those decisions could directly impact us and what we care about. But at the same time, how do we keep healthy? Kurt, I'll start with you, then we'll go to Barbara.
Number one is connections with other people.
Yeah.
I certainly love, again, this same friend I was having drinks with last night, she was at a training with me yesterday. She said to me after the training, she's like, you're like a collector of people. You know, I was going around talking to everybody. I enjoyed it, you know, I just enjoyed it. But that for me is incredibly important, is having good social connections and being able to use those as ways to take care of myself is probably my number one way. And certainly making sure that I'm a good social connection for them as well. Yeah. That's probably my number one way.
Barbara, what are some things you're doing?
I think a couple of things come to mind. One, much like what Kurt had said, I'm being really conscious about maintaining a wide range of my friendships and really making sure that my connections with my social peers are strong. Not surprisingly, a lot of the folks that I spend my time with are also doing work in various ways, either in the justice movement or in service. And so we share a lot of values, and we also share a common view on where we think our communities should be headed. And so I think keeping those connections has made me feel more balanced. Being able to let you know, just have fun with my friends is, you know, everyone loves doing that. So I think that is maintaining my connections and making sure that at the end of the day, when you feel so drained, that I'm not just closing off, that I'm just going home and becoming a hermit, which I think is sometimes tempting. I find it rejuvenating to be with other people. I'm also doing a lot more with yoga. And I know you actually talked about this in a previous episode about the power of yoga as self-care. And I was delighted to hear that. And it seems like there's a yoga revolution going on right now, which is very interesting because I think that you're seeing a lot more people go to yoga and mindfulness and meditation and these, because people are seeking ways to be able to find more balance in what they're feeling. And so many people express to me, I feel angry so much of the time now. And we see that manifest in road rage and our interpersonal relationships and at work, and our fuses get short. And Matt, I'm going to come back to your cups. You know, your cups get really full, and then we've got no space to be able to be the people that we want to be. And so for me, I know I felt like I was getting into a space where I just felt like my cups were full all the time. And so I enrolled in a yoga teacher training course. And so right now I'm working on my certification, and it has been very helpful in teaching me a different way of seeing how balance is helpful in maintaining a longer view toward where we need to go. And with this, let me, if you'll indulge me, an American history segment just for a moment.
Absolutely.
Our advocacy has got to be focused on the long goal. I think we get so focused on short, quick turnarounds. And some of the things that we think of as just being absolutely basic nature. Like, for example, I would imagine most of your listeners do not think that a woman voting is a crazy, outrageous idea. And yet when you look at how long it took for this country to adopt the amendment to the Constitution for a woman's right to vote in every state, that didn't happen until 1920. And if you can remember back to your US history course, do you know when we first, that Seneca Falls Convention with Susan B. Anthony and all of those early people, that was in 1848, where they said women need the right to vote. And it was 72 years later that we got the right to vote, 72 years. The idea that Susan B. Anthony never lived to see a legal vote is something that most people are unaware of. And so this idea of how long does it take for us to get just basic, decent, civil and human rights? So the idea is, how is it that I can be effective in this work for a career, for my life? And not just making it to the next legislative session or through this budget cycle, or, this is the kind of thing where how do we sustain a community of values that is multifaceted? That takes our engagement over a long term. So we need to be we need to calibrate ourselves and find that balance. We can't burn too hot, but we can't burn too low. And that's going to look different for everyone. So that's a very long answer to your question. But at the same time, I think we're all going to find those self-care strategies in different ways to make us effective for a longer view goal.
Yeah. And I want to sort of, I challenge all of us, and I'll give you a little bit of time as I say my next spiel of coming up with a New Year's resolution for our own self-care. But I also want to share a little bit of thinking that I've had on self-care, because if you're not familiar, I do a lot of self-care trainings around the country. And so one of the things that, as I've thought about this, and I did a big series, it was about a 7-month-long series on self-care with the blog, starting about a year ago. So if you want my deep thinking on self-care, you can go back to that. It's the same website that the Trauma Informed Lens podcast is hosted on. But one of the things through that exploration is I no longer distinguish self-care as its separate entity. And to just give a little bit of thinking on that, if I'm going to be an effective case manager, advocate, leader, physician, medical provider, a front desk person, I see now that self-care is as important as any other skill set that I might have. Because I might be a guru at MI or EMDR or advocacy. I may have all the knowledge in the world, but if I'm burned out and traumatized from my work, I'm not going to be effective. So in many ways, my challenge to folks as we think about self-care, I really challenge you to stop thinking about it as something you do if you have time to do it. Because I have not identified a bigger, really foundational driver of outcomes than our own well-being. Because a lot of us, and most people listening to this, I know we got a lot of different roles and a lot of different focus areas, but we're in some ways in the process, we're in the business of creating healing relationships with folks. And we really just need to make sure that we have the energy to do that. So we're going to spend a little bit of time at the end talking about Barbara's work and some of the additional resources we have, and the Memorial Day that's coming up next week. But I just want to kind of end this section with each of us setting a goal to a national audience that can hold us accountable. Kurt, if you were to set one New Year's resolution around self-care, what would it be, my friend?
It would be to exercise more.
That's a good one. Foundational one, in my opinion. And again, I think the important thing, if you're looking for a place to start, it's the sleep, exercise, and diet. That physical health drives all other aspects of our health as well. Barbara, what about you?
One thing I've been looking forward to is getting more involved in my local neighborhood community association and being part of a conversation in my neighborhood.
Yep. And I'll throw one out there too. I did great on last year, so I'm really excited about this year. I needed to floss last year, and I've been flossing for an entire year now. So, and I hate flossing, but I've done it. So mine is I think kind of with Barbara's is to get kind of more involved. What I find is a lot of times, and I think a lot of people I talk to get here is you get to 4 o'clock or whenever your day ends, and you're just exhausted. And how can I really also, in many ways, engage with my local community, but also try to find speakers that are coming to town. And so I don't find myself sitting there watching the news all night and getting more and more frustrated. So there you go. So now you can all hold us accountable to those goals. But I want to wrap up our time together today. Barbara, kind of sending it back to you to give us some information on this Memorial Day that's coming up, a little bit of what it's about, why it's important, and some really great resources I know that are coming out through the National Council as well.
Great. I'm just completely pleased to talk about Homeless Persons Memorial Day. And for those who may not have attended one of these events or have heard about them, these are public vigils, generally on December 21st, the longest night of the year. But sometimes it can be right around time to honor people who have passed away, who experienced homelessness in your community. We, along with the National Coalition for the Homeless and the National Consumer Advisory Board at the Council, have been working since 1990 to try to raise awareness of these events and encourage people to organize and attend these events in their local communities. Last year, we were aware of about 130 HPMD events in the country, and these can be everything from major urban events to a dozen people in your small rural community who are acknowledging the man who used to, live downtown and passed away. And so whether you are aware of one person or aware of hundreds, there are organizations in the country who are really taking an active tally every year of the people who passed away. I think it's no stranger to this audience that homelessness is hazardous to your health. And when you're living on the street and when you have got a lot of issues together with weather and chronic illness, the rates of mortality are extraordinarily high in this population. And this is what happens when you don't have housing. And so we're seeing people who are passing away on average 30 years earlier than their housed peers. And so one of the things too about these events is trying to balance the idea of having a vigil where we can honor people who passed, but also use this as an opportunity to raise awareness about the injustice of people in the United States of America who die on the street. And I just think that this is these are the examples that we need to raise awareness of in our community to say, this is wrong. And regardless of what your political affiliation is, the fact that we have people living on the street as an endemic problem in this country is something that we all should be able to find common ground on to say, that's not right. And no one benefits from homelessness. And I think particularly around the holiday season where there's a big push toward charity. We just had Giving Tuesday and these charitable events. But the idea about justice in our policy. This is not about charity, this is about justice. And how is it that we can come together to have dignity for people who often weren't recognized and did not have a memorial service for them, and making a collective statement about what we want our community to be. I think this Homeless Persons Memorial Day ceremonies can serve two purposes. So whether you are in a position to organize one or whether you're in a position to attend one, this is an opportunity to come together with people who have got a common interest and a common vision for where we would like to go.
Awesome. And just to encourage you as we talk about connecting, especially outside our silos, and realizing that there's a lot more of us than it can just seem when we're in one organization or focused on one area. It's a great time just to connect with other people around such an important issue. And again, I think that it really, the whole experience is you see somebody on the street corner panhandling for money. so easy to judge that person in so many ways. When you dig into it a little deeper, there's histories of trauma there. There's lack of resources in our community. And if we're going to end homelessness, which I believe we will, I went to Denmark last year. They don't really have homelessness in Copenhagen. You know, it's something that we can solve. We're going to need educators. We're going to need people in child welfare, juvenile justice, all of us coming together to address this. And boy, if we can address homelessness, we're also addressing a lot of other issues along the way as well. So again, just another opportunity to honor those that we've sort of let slide through the cracks in our community, and we haven't given the right trauma-informed sort of approach to at this point, but also hoping that soon we won't have to have something like a homeless person's Memorial Day. That will be a thing of the past. We'll still hold those people, but we'll hold them as inspirations for ending this epidemic that's plaguing our country. Kurt, before we talk about some of the resources, any last words for this week's episode?
Boy, I mean, really, just to thank you, Barbara, for coming on and being able to share what you do and let me ask you really stupid questions and give you such great answers to them. I mean, what a pleasure to be able to sit down and have a conversation with somebody like you. Just want to thank you for allowing me to be a part of this and to be able to talk with you and to collect somebody else as somebody that I know. That is just a wonderful experience for me. So thank you so much.
I'm delighted to be part of your collection. Thank you so much for having me on.
Barbara, you want to talk about some of the other resources coming out this week along with the podcast?
Yes, so an exciting day. So we're in the collaboration that we're doing together. This podcast is coming out on the 12th, and that's the same day that we are releasing our mobilizer, which is going to be dedicated to self-care this year, or this month rather. And so we're excited about linking these things together. We have on that mobilizer, and if you can sign up for that on our web page, we'll put some of those links here in the show notes. We have a homeless person Memorial Day organizing manual. If this is something that you would like to pull together, even if this is just together with a few of your colleagues, if you wanted to get together and remember a client or two or more that you know of that passed away, do that. These things start small and they grow. And so don't underestimate the power of just coming together in small groups. So we have an organizing manual. We have a lot at the National Council. We have a lot of self-care resources as well in the clinical space. So we'll share some of those as well. We have a Twitter chat. If your listeners are into Twitter and are doing it, we have a Twitter chat around Homeless Persons Memorial Day on December 21st at 2 p.m. Eastern. So that's something you can learn more about in the notes that we'll send out as well, and at our website at the National Healthcare for the Homeless Council. Also just want to just give a shout out to my team, Catherine Cavanaugh and Regina Reed, who are on my team. Regina does the mobilizer, and so if you get that, you'll see that come from her. Catherine's been doing a great job working with our National Consumer Advisory Board to really organize and call attention to how these can be motivational events for social change in our communities. So want to give a shout out to my team there. And also want to just mention that we've got a wealth of resources at the National Council's website in general for a lot of the clinical work that you're doing. So please check us out. And if you're not an individual member, which is free, please sign up with us. We do a lot of trainings, webinars. We have a lot of resources, and we would love to work with you as well in the provider space to make sure that you've got the tools and support you need to do a great job. Did I forget anything, Matt? I think
you nailed it all. So the other plug that I would put in is, especially if you're in an arena like maybe you're a teacher or working in another profession where you may not think about homelessness on a daily basis. One of the things I love about the National Healthcare for the Homeless Council is, they just have great people all over the place. So they can also, if you don't know where to go to get a family or somebody resources, you could go to them and they'll probably be able to connect you really quickly to the provider in your area, whether that's state, but a lot of municipalities as well. So just a great resource, and there's a wealth of training on their website as well. So if you're interested in this topic, so much there. So Barbara, I'd love to thank you, my friend, for joining us. We got to have you back sometime soon. I'm sure we can find another topic to chat about. We've co-presented a couple times. Kurt, you'll probably appreciate this being around my age. And I like to show when we get in a room or a space together, the Ghostbusters videos of the streams crossing, because it is somewhat dangerous to get us both in a room together with our excitement, passion, and ability to squeeze 3,000 words per minute into a training environment. But it's always a pleasure to work with you, Barbara. Again, there's going to be a lot of show notes coming online with the links Barbara mentioned. Also, we'll link to the blog post that really outlines a critical self-care plan that you can kind of integrate into your own plan or start a plan if you don't have one. And that'll all be at trauma-informed-lens, all one word, .org. You can find all the show notes there. Also, you can see our fun videos as well. If you haven't seen a video, I'm wearing my Healthcare for the Homeless shirt. And if you send me swag, I will probably also wear it during a podcast. So I love nonprofit swag. So you can get my address here, XXL, XL, whatever you want to send. So my goal is never to buy another shirt in my life, but just to wear swag I get as I travel around the country. So Barbara, Kurt, great show. And again, check out our show notes page. And again, I hope that this introduced the topic to you and gives you some good resource moving forward. So take care of yourselves, my friends, and we'll see you next week.